Hello, so today we will be talking about healthcare reform in this presentation. My name is Marlene Mejia Quinteros. To begin with, we will start with healthcare in the United States, how it is and how it should be. Second of all, finances, universal coverage, how to improve quality and population health status, and how to reduce healthcare costs in the United States, community involvement on decisions, and we will be concluding after that. So, healthcare in the United States. The US healthcare system spends millions yearly to help individuals get the best medical attention and services. Still, it's not the best because there's so many outcomes such as like low life expectancy, high suicide rates, we have the highest chronic disease burden and high rates of obesity. So people are not using the healthcare services because of the high costs that come along with it. So if the US spends the most on healthcare, it's going to be all right. Just as long as it's essential to make sure that there are affordable costs for individuals to get their medical assistance and help improve their overall health. So there's no point in spending so much money on healthcare if there are still so many health issues that affect people, making their health be at risk. So it's important to focus on risk factors to reduce the health issues that certain people face. So, why is it vital to fix the healthcare system? It's vital to fix the healthcare system because we need to make use of the healthcare system with the high spending that is given in the United States and services that each individual needs based on their health. Okay. So, the Organization of Finances in the United States, the government must make an outline of spendings, including every age population. It's crucial to spend efficiently to get the best results regarding the health outcomes of individuals. Therefore, it is vital to implement steps on controlling the finances to develop a well spent healthcare system in each category. Sorry. And so if we address each issue in each category, we can address health issues in different states. So spending on healthcare services, such as products in the United States, um, so far it's about 1.3 trillion as of 2000. So as you know, every year it increases. If we look at it now, it's probably really, really, really a huge amount, you know? If the government is spending so much money, then they should ensure that the widespread diseases, infections, and more that affect people's health is being addressed. It's essential to spend wisely on healthcare in ensuring that everyone is getting the necessary health assistance at a reasonable cost. So we can develop programs using fundings for the uninsured and basically make sure that the finances are being equally spread on a variety of programs that include everyone. So when it comes to universal coverage, not everyone qualifies to get medical assistance under medical or programs that are funded by the government, such as Medicare, Medicaid, and much more that we have here in the United States. So if the government must include programs that give everyone medical aid to decrease the number of uninsured people to help address issues before it further complicates. Expanding coverage for everyone can help include various options for people in both the private and public areas. Universal coverage will benefit every American because it will provide medical assistance and insurance. Therefore, everyone needs to understand that universal coverage will not leave anyone out when it comes to having insurance to receive medical assistance. The healthcare system leaves many uninsured aside, unable to have any medical help due to high costs or other specific reasons. Universal coverage will solve many uninsured people in the United States. and we can address significant health issues that keep failing to improve and improve the health status of every individual in the United States. So how to improve quality and population health status? So it is essential to focus on the main factors that can improve or maintain everyone's health in the United States. Community networks can significantly impact people's overall health because the leaders can serve as role models, helping the people in their own community adopt healthier lifestyles, encourage one another, and link up to get helpful resources and more from each other that can benefit their health. Often people must see things to believe. So if people in the community say that one thing has helped their health, they can be a significant influence to help the other person adapt to that change to support their overall health. If we reduce healthcare costs, more people will seek to get medical assistance because they know that it will not create more stress since it will be affordable. If the government spends so much on healthcare, everyone should receive quality healthcare at an affordable price. Quality healthcare can bring many pros that can prevent diseases or health risks from progressing. The reduction of barriers between departments will help address the main determinants of health. So, how to reduce healthcare costs in the United States? So, there are many ways to reduce healthcare in the United States, but it's important to prioritize factors that will benefit the patient because they're the ones that receive the care. If we give patients and consumers more information and power, it will help them understand that there are different costs and various types of valuable information that will provide the patient or consumer the opportunity to make smarter choices and save money when it comes to their health. If we decrease the number of medical tests by physicians carefully assessing the patient and not using a test for every medical visit, there can be a significant amount of costs easily reduced. Tests should only be offered to patients if necessary to help the healthcare costs in the United States. If there's competition among healthcare providers, there could be more potential competition in the market, resulting in less high costs. So as I did my research by the Scan Foundation and Lawrence, they illustrated that more competition leads to a better quality of care. So as we know, here in the United States, many prescribed medications can be costly, and many people do not take the medication because it's too much money and they can't afford it. There could be a massive decrease in prices, resulting in fewer healthcare costs for the individual if there is a negotiation on prices with cheaper brands or some type of program that helps individuals with medications. Community involvement on decisions is super important when it comes to the health or just anyone that lives here in the United States. Every person deserves to be involved in decisions that could potentially affect their health, and everyone should have the right to have their voice count in decisions that concern them. If we incorporate the voices of communities, we can dig deeper and help address issues that these communities face and supply them with the direct necessities that could improve their health statuses, such as food, medicine, utilities, housing, more, and just simple things that can benefit the individual. It is crucial to understand what is needed in communities to fund and provide based on what is required, and based on just listening to the community. The people living in communities can significantly impact decisions if professionals carefully inform them about healthcare to improve their community health issues, depending on what they see needs the most attention. So, as we can see, community makes a big impact on decisions when it comes to healthcare. So it's essential to make these changes in the healthcare system by reducing healthcare costs for individuals, providing coverage to every person in the United States, and having an organization with the finances that makes sure that funds among people, programs, and more are distributed equally. So these are my references, and I will be posting a link to my video. And thank you for watching.